Hi, good morning, ladies and gentlemen. Myself Dr. Rao, Senior Consultant Cardiologist practicing here in Nasik, Maharashtra. Today I would like to say something about very much important called cardiac pouch. I hope so that you might have heard a pouch. A pouch is a small bag, a pouch is a small purse. Now what is this cardiac pouch? That means where we are keeping some important cardiac drugs which we can use in emergency in a small pocket, that is called as a cardiac pouch. I think you might be keeping many things in your pockets, upper pockets or the pant pockets, like your bank cards or some cash or some coins or pen, whatever it may be, or your business cards. Like that, you'll keep many things in your pockets. Like that, it is also important thing to keep a cardiac pouch in your pockets or in your purse or in your handbag or your business bag, etc. What is this cardiac pouch and what it contains? Say this cardiac pouch contains very important 3 drugs and an add-on 1 drug. That is, one is called as ecosprin 325 mg dispersible tablet, atorvastatin 80 mg, clopidogrel 300 mg, and a new add-on drug that is called as an rabeprazole and doperidone. And who should take these drugs and who should keep in their pockets? Any individual, irrespective of gender, irrespective of age, getting a sudden acute retrosternal chest pain, a center of the chest, a pain, or if you're having a pain in the interscapula, or a sudden radiating a left hand pain, or if you have a sudden radiating a right hand pain, or a constrictive feeling in the throat and in the teeth, any kind of discomfort in these places, you kindly take this cardiac pouch dose immediately, because we consider these pains related to an acute coronary syndrome. Commonly we call it as a heart attacks. You know that nowadays even to get an ambulance it takes lots of time, it takes a long time, but if we take in any acute chest pain this medication, it gives us minimum of 6 hours of time. 6 hours of time it gives for us until we reach to the hospital for further treatment, or until we reach the ambulance has to take to the hospital for further management and treatment. So these drugs helps to reduce the blood clotting in the heart vessels. In the heart vessels, it reduces the blood clotting in increasing the further. And you should know then who should keep. Then who should keep and why we should keep. That now we have come to know why we should keep. But who should keep? The most vulnerable patient should keep. Now who is vulnerable? That means if you are a diabetic, you are vulnerable. If you are a hypertensive, you are vulnerable. If you have a high cholesterol, you are vulnerable. Or if you have a recurrent non-atypical or typical chest pain, you are vulnerable. If you have a habit of chronic smoking or tobacco chewing or an alcohol intake, you are vulnerable. See, all these vulnerable patients should carry this pouch in their pockets. Remember that it helps you. This gives you 6 hours of time unless you reach to the hospital. This is very important thing what I am stressing and telling to you to keep this drug. All the vulnerable individuals should keep this cardiac pouch in their pockets, and it should be used in any emergency. See, for example, with this cardiac pouch holding in your pockets or holding in your house or in your business, if anyone nearby to you get a chest pain, for example, if your mother or if your father, if your brother, you get chest pain, if you give this dose, definitely you are going to save their lives. Or if you are for your neighbor, if you give them in an acute chest pain, you are going to save the life of your neighbor or your colleagues or your professionals, anyone who is near to you, you are going to save their life. You don't forget that this cardiac pouch is helping by keeping in your pouches the other's life who might be very close to you in any relations. So as a doctor and as a cardiologist, I request you all the vulnerable patients to keep this pouch, as I said, with the medicines in your pockets, which can be used in any kind of chest pains in helping to save the life of yourself as well as others. Thank you.